Right. Members of the community are invited to an event next week that aims to answer questions about local health care access. Spectrum Health Healthier Communities is sponsoring the meeting. Among the topics to be addressed are finding the right health care options for those without insurance and local health care providers. The event is Tuesday, June 22nd at 6:30 at United Methodist Community House. Registration is required to attend. You can find information, how to register, all that information for you at woodtv.com. The deadline, though, is tomorrow. Dr. Corey Waller will be the guest speaker at the event. He's joining us right now in studio with what people can expect when they show up. So a lot of topics to cover.
Yeah, I think the first one is really the most important, which is the one we're going to be covering on the 22nd, and that's really how to access health care in the structure that it is right now. You know, we're not going to be talking about future stuff, just what you can do right now to try to find a physician, a medical home, and to get help.
Tell us, is it a problem that you run into on a regular basis, just finding the right doctors for people? Let's talk about that.
Well, it's not even necessarily the right doctors. It's any doctor sometimes. And so a lot of times the fallback ends up being the emergency department or urgent cares, and people are doing anything they can to get health care. And so what we're trying to do and partner with Spectrum Health and Priority Health and Healthier Communities, as well as a number of other entities, and we're not making this truly a Spectrum Health event. We're going to be talking about access to all of the medical groups and hospitals in the city, and ultimately we find that there are three major groups, and one of those is those that qualify for Medicaid, and DHS does a very good job of evaluating those patients through speaking with a counselor. Those that have health insurance or are capable of getting it, and then the most difficult group are those that don't qualify for Medicaid but maybe don't have enough money to get health insurance on their own. And that group of people, it's really difficult to find a physician, to find a clinic, to be able to get in and even get something as basic as blood pressure medicine.
So it sounds like you're taking a very vast subject and breaking it down as to who can benefit,
right,
and especially for people without insurance. How do you direct them?
Well, ultimately it starts with giving them an idea of the vast things that are available. It's just that they're very discombobulated. They're all over the place. You have you can Google search it and you get 100 hits, but really only 3 of those things are actually taking patients. And what it'll do is help them to understand what category they fit in as a patient: a healthy person, someone who's very ill, or someone who needs special care, and then allow us to direct them in the right way. And then we'll have people there which will actually help them to even very specifically direct them via phone numbers and times and even specific doctors.
So it's a matter of really breaking it down. Are you going to have more of these?
Yeah, the goal is to do this quarterly, to start off with making sure that people who want to get this information can come, and we can deliver to them as best we can the consolidated form instead of some big stack of papers. Just really hone it down to the basics and get people into the system quickly. And once that's done, really try to focus on even issues that we don't get a chance to talk about, like you know, diabetes, race in medicine, all of these things that are really topics that people want to hear about and talk about, and they deserve to be able to hear it in a form that they can ask questions and hear it from people who you know a lot about it.
Only 60 spaces left. You do have to register. The deadline is tomorrow. We have a lot of information on our website at woodtv.com. Dr. Corey Waller, thank you for joining us tonight.
Anytime.
Brian.